start of a great series and a really good collaboration to really get practice development and research out there for nursing and midwifery and grow our capacity and our capability across our staff. So my name's Barb Crawford, for those that don't know me. I have a background, my home is the Illawarra. I've worked there for a long time, so very close to my heart. I now work up here in southeastern Sydney, which I also love, and I work in the district nursing midwifery team. I'm a nurse manager for developing practice and workplace capabilities. So before I start, I'd like to acknowledge the traditional custodians of this beautiful land we stand today. Today I'm on the Dharawal land at Sutherland Hospital, and I pay my respects to the elders past, present and the future. Thank you. So now I have the absolute pleasure to introduce to you all Professor Val Wilson. Val holds a joint appointment, and I'm sure you all know her out there. She holds a joint appointment as the Professor of Nursing Research at Illawarra and Shoalhaven, LHD, you're very lucky down there, and the University of Wollongong, and is currently 1 day a week up here with us at Prince of Wales Hospital. She has vast research experience, and today she's going to share some of her practice development journey and outcomes of her work, which we know will inspire all of us across southeastern Sydney and Illawarra, Shoalhaven. She's been an active member of the International Practice Development Collaborative for over 15 years, and she was crucial and fundamental in supporting our district up here in southeastern Sydney for a successful application to become a member of the IPDC in 2020, to which we are very grateful and very appreciative of, and it's a very exciting time here for us and getting practice development out there into every unit, and that all our staff know what practice development is, but more importantly what those principles are, and it's a way of being and a way of working. Her teaching really is focused on person-centered practice, leadership, reflection and facilitation and culture change. She's currently supervising 12 HDR candidates, so very busy, Val, so we're very grateful to have you in this space with us today. Today, Val's going to share her, as I said earlier, her PD journey. There'll be an opportunity at the end to ask questions. And what we will ask is, before we close this virtual webinar, if you could complete the online evaluation, it would really be appreciated. And there will be some questions just asking what the preferred days and times and focus areas and topics that you'd like to see in this space. This is the beginning, and we're really happy to co-design this with you, but we really feel that there is a thirst out there for our colleagues and for our staff to really start delving in and getting research into practice and developing our own research and practice development collaborative. So I hope you really enjoy this masterclass and sit back and enjoy, and there'll be a chance to ask some questions at the end. But please, this is your space. Thanks, Val.
Oh, thank you, Barb. It's rather embarrassing to hear someone introduce you, really. So I steeled myself during that bit of uncomfort. And I just wanted to acknowledge that there are more than nurses and midwives on the call today. We have some other staff. And welcome everybody. And I know we've got some people from the university. I can see Helen Pratt there, and we've got people all up and down the coast. So that's really great. So I'm going to try and keep to time, which is always a challenge for me. Susie's she's on the clock, so she's going to remind me when I've got about 5 minutes left, and I'll probably only be on slide 3 by then, so I'll rush. But I'll try not to rush, because some people tell me I've got a bit of an accent. I don't actually hear it myself, so just bear with me. I'm going to just share my screen so that at least you've got pretty pictures to look at. So, okay, and start slideshow. So hopefully everyone can see that there now. So when I was asked to do this first talk, it was kind of like, oh, well, what will I talk about? You can talk about so much. And I think a lot of people online today probably do have a very good understanding of practice development and its intersection with person-centered practice and research and quality improvement and all those things. But there may be a lot who haven't really had that background. So I thought I'd just do a little bit of a potted history through my journey with practice development. So please, I'm old, so I've got lots of history, so stick with me. I'll get you there in the end. I just wanted to acknowledge, Susie said earlier about the fact that South East Sydney LHD has joined the International Practice Development Collaborative, and I thought it might be appropriate actually just to acknowledge all of the IPDC members who come from a range of countries around the world. We are quite well represented here in Australia with Tasmania, Sydney Kids Network, Sydney LHD, University of Wollongong, Queensland University of Technology. So we're very well served here across 4 states. I'm going back to the beginning. Now, just to make clear, 1921 was not when I started my training. You know, I was a little bit after that, but that's when the hospital that I first trained at, it was established, and that's where I did my training. But why I've got the picture of this child in the bed is because when I was a young child, I spent quite a lot of time in this particular ward that's in the photo here, although this photo is probably about 7 or 8 years before I was born. But I spent a lot of time in that ward because I was a patient. I had polio as a child, and I spent quite considerable periods of time. And an incident that occurred when I was 4 has shaped my whole career, even though I didn't think about it consciously, but it was the precursor for me wanting to be a nurse and for me wanting to be the right kind of nurse that cares for children and that acknowledges parents. And I won't go into the details of the story because we haven't got a lot of time, but I think each of us has something that drives us in our practice, and we need to kind of think about what that is. And sometimes we get lost a little bit along the way, and it's a really good time to step back and to think, what is it that drives me? What is it that is the basis of my practice and what I want to achieve? So I started off life as a paediatric nurse. I came to Australia in 1987 and redid my training because paediatric nurses weren't actually here in Australia. So I redid my training, and then I became an educator. So excuse me. And you know, as an educator, transitioning from being a clinical nurse to an educator is quite an interesting time. And the reason that I've put the word slow up here is because when we're in clinical practice, we tend to think we have to go fast, fast, fast. And when you move out of clinical practice, you still have that mindset and you want to engage people and get them to do things in a really, really fast way. So you take the model that you've learned all those years and practiced into your new role, and it doesn't actually work. But it took me, because I'm a slow learner, it took me quite a long time to realize this. And it actually, I had already been nursing 21 years by the time I got the message that I needed to slow down in the way that I approached people. I needed to look at the perspective, not just think that what I seen in front of me was real, but actually look a bit deeper at that. And I learned this lesson when I was in Indonesia with my colleagues. It's the only time that I looked really tall with a group, I have to tell you, which was fabulous. But I was with my colleagues and I was telling them things about medication safety, and it really occurred to me partway through my talk, they were looking a little bit uncertain, because what I was talking about was a very westernized model of medication safety that they just did not have the resources or privilege to have. And so sometimes we take a lot of things for granted, but we also need to take into consideration the context in which we practice. And every context we practice in will be different. And that's where practice development has really helped me think about how I go about my everyday business. And it's helped me to realize that you actually do need to look at more than just a set of tools and approaches. So I went to practice development, the foundational school in 2001, and that's where I learned my key lesson, one of many lessons I've learned in my life, but a really key and fundamental lesson, because What I learned at that time was really that as an educator, I had been working with my colleagues and trying to get them to change. And the fundamental thing I learned is I needed to take a step back and work with them on what they thought was appropriate to change, not me. And it seems quite simple, but that subtle working on or working with was then what I've based my work on since that time in 2001. So that's some 20 years ago. So if you add up the 21 and the 21, you'll get how long I've been nursing. It's a long time. I did do some formal study. I was really interested. I had already done my master's looking at child's day surgery and the experience of parents, and I was particularly interested in that because often staff would be quite dismissive of parents' anxiety for day surgery. And what I found out when I actually interviewed parents was that every single parent I interviewed imagined their child, no matter how minor the surgery, they imagined their child dying on the table. So if you put that lens on a parent's anxiety while they're coming for their child to have a minor procedure, it can help you understand more where they're coming from. So I had done that study, and I had just finished it in 2000 when the PD school happened in 2001. And that's where I had my, I suppose, my epiphany and thought, oh my goodness, you know, there are different ways to do things. And perhaps what I've been doing for the last 5 years in my education role, why it's not been sustainably successful is because I've been going about it the wrong way. So I was enthusiastic, but a bit of me said, these kind of approaches sound too good to be true. I'm not sure that the reality of practice and that context that we work in is like it says, because when you learn about these approaches in practice development and the theory behind it, it all sounds so simple, but we're dealing with people, and when you're dealing with people, it's complex. So I was interested in looking at it a bit further, and I was encouraged, persuaded, pushed, cajoled, whatever it was, into doing my PhD, and that's what I did. And I looked again at the notion of family-centered care. As a pediatric nurse, that was the bedrock of our practice. I really wanted to know if family-centered care was what we were actually doing, and I used an emancipatory PD approach to do that. Now, the interesting thing is, I told you in the beginning, I was that young child in hospital, a particular event just before my 4th birthday that shaped who I am and why I wanted to become a nurse. And you could see here in 2005, I was still looking at this notion of family-centered care and how we take care of not only the children, but the families within that perspective. So it has driven my career all throughout my career. So we just set ourselves in today's healthcare practice, because obviously when I was training back in the 80s, it was quite different. And even then, when I was doing PD school back at the beginning of 2000, things were different to they are now. So at a global level, contemporary healthcare is about person-centeredness. It's viewed as a philosophical underpinning of how we do business. Now, the interesting thing about person-centeredness is sometimes it can be confused with patient-centeredness. And to me, person-centeredness is about all people within that paradigm. So it is about patients, and it is about their carers, so their loved ones, their family, but it's also about staff, and it's also about the organization. So it's about everyone. So it's more encompassing than the old notion of patient-centered care, which focused on what was right to be done for the patient. It does refocus us on the fundamentals of our practice. It helps us understand our practice from the perspective also of the patient. And it is about improving that patient's experience. It is, as you can see, working in partnership. It is about driving effectiveness and efficiency. And some people don't realize that when you're doing practice development stuff, it can actually end up being a much more effective and efficient way of doing business. It's not all about looking at nice value statements. It's actually looking at how to do practice in the best possible way. More and more in the last decade, we've seen this emphasis on quality and safety. And in order to achieve that, it is about transforming the systems that we work in. Oops, gone too far. So this concept analysis of practice development, you can see here back from 2002. It was actually published in 2002, developed before then. So when I first went to PD school, this was what we were working with. It was about facilitating learning. It was about authentic engagement. And actually in the 2002 model, it wasn't person-centered culture that was in the middle, but it was patient-centered care. So we have had quite a shift from that time. But you can see here on the other side of the screen, we have gone from that concept analysis to creating this global manifesto in 2021, which really puts practice development principles out there for everyone to use. I'm not going to go into details in these. I'm sure if you read through them, you will understand most of them. So there's that working with that I talked about earlier, which is the CIP principles. There's the fundamental that it is about person-centered practice, and it is about safe and effective workplaces cultures that we can all thrive in. It is about being critically informed and using evidence and being active in our learning and using different approaches. At the end of the day, it's creating supportive relationships to achieve the outcomes that we want to achieve for our patients, our staff, and our organisations. Now, the reason I've got the photo gallery at the bottom there is because this PD manifesto was a collaborative approach made up of all these beautiful people, a few of them from New South Wales, one from Tassie, one from Switzerland, and two from England. And so it really was a collaborative. We used the CIP principles to actually create the manifesto and build on the previous principles of practice development. So to me, the key fundamental often when I'm working in practice is checking out the difference between what we say we do in practice and what we actually do in practice. So it's that espoused notion versus what you actually see. And if what we want to achieve is person-centered practice, we have to take into account that macro context, which is the context where, you know, there's the kind of policies and workforce development and strategic leadership. And then we move into the prerequisites. We obviously want staff who are well skilled, and we want them to be committed to the job. And then we move into that practice environment. We want practice environments that are helpful, that have appropriate skill mixes, that the physical environment is even conducive to ensuring best care. And then we go into the person-centered processes in the middle, and that is how we achieve that outcome of helpful culture, is working with people, engaging authentically, shared decision making, working holistically, and this thing called being sympathetically present, which I'll just be clear for you, isn't having sympathy, it's being there and being there for another and being able to listen and to hear that person and what's important to them. So that's what that is. Now, why I say rhetoric versus reality. Let's just take an example from everyday practice. You can go on to a clinical area, a ward, and you can listen to the dialogue of what's happening. And this still happens today. It did happen when I was doing my PhD. So what happened when I was doing my PhD, I was working in the special care nursery, working with staff doing PD approaches. And in that time, as I was listening and observing practice, I could hear staff referring to babies by their surname only. And I was curious about why this was. And even the parents, if there was similar surnames, they'd say baby Smith, baby of mother Sharon. That's how they would talk about the baby. Now you might say, well, the baby's maybe not been named yet. And certainly that was true for a small number of the babies. But a lot of these babies had been there, you know, for 10, 20, 30, 100 days. They had names. So why was it the staff were not referring to them by their name? And it was really interesting. It was just a rote practice that no one thought about until I started talking to them about, well, why is that the case? And I was raising their consciousness to the everyday practice that they just took for granted. They never even thought about it. It's just how it was. The same thing happens in clinical areas everywhere. When a patient is called by a disease process or a bed number, it's the same type of thing. If we say we're truly person-centered, we need to connect to the person. And if we're going to connect to the person, then we need to be engaging in an authentic way. And by referring to someone as the stroke patient or the patient in bed 15, we are taking that part out of our practice, and we are not doing what we set out to do, which is to be there and to care for patients, to be connected with them. And this notion of personhood gets lost, and people just become numbers shoved in a box and able to be dealt with tick boxes and get out at the end of the day. Practice development is about taking a step back from that and really looking at what we're doing and how it's helping us achieve what we want to achieve in practice, which for everyone is this notion of a healthful culture, one where we can all thrive, one where patients feel supported and cared for, where they can learn to care for themselves, and that their well-being is taken care for. But equally, we want to have an experience where staff also feel like they are cared for within the context of our practice, that they are supported in the best way possible to achieve what they want to achieve. Now, this is one of my favourite sayings, and I do overuse it, so I do apologise to people who've heard it time and time again. My life since I finished, well, even in my PhD, so that's for the last 20 years, has been in the swampy lowlands, as Donald Shorn would call them. And what he says is, we can research from a high, lofty area about problems that, oh, they might be theoretically really interesting, but they don't actually lend themselves to managing the problems we have in our everyday practice. And in order to address the issues we have in our everyday practice, we need to get closer to on the ground and be with people in those practice areas to try and help us understand what the issues are and to work with people to come up with solutions. So as he said, however great the technical interest may be in those other problems, while in the swamp lie the problems of the greatest human concern. And I'm sure some of you at times have read some research articles and think, oh, well, why did they even research that? What's the point? It's not got any relevance to my practice. So that is really important to me, because I think that my life and my work is back where that 4-year-old girl was, back in practice, helping people understand the difference between what they say they do and what they do, and also helping them understand how things could be better for themselves and for patients. So in order to do that, these are the kind of principles that I use in my everyday practice. And hopefully I am not only using them, but demonstrating them in the way that I work with people. So it's about working collaboratively. It is about having that end point of person-centered culture. Now, there's a bit of debate whether you can totally have person-centered culture or whether you can have person-centered moments within the culture. And I'm not going to go into that debate today, but just to understand that that is out there. But it is about learning in and from the workplace. There is so much that happens in our workplace that we can learn from that, but often we don't. And so it's really important to have that critical dialogue and that critical reflection on what is happening in the workplace in order that we can learn how things could be different. It is about using and developing knowledge, but also influencing policy. I was talking to someone yesterday that was looking at, it was around a fluid balance chart. You can't get much more basic than a fluid balance chart. And she was telling me that the compliance with fluid balance charts, even for patients who are in areas such as cardiology and renal, is not that great. And she was puzzling, you know, around the policy, and the policy was unwieldy. And saying, well, the policy's been set as too high a higher bar, so we can never reach it. And I said, well, what are you going to do about that? And she said, well, there's nothing I can do. But this is often how we get, we give away our power. We say, oh, well, there's nothing we can do about that, so we'll just put up with it. No, we can't. Each one of us has the power to do something, to act. And that's what practice development is about. It's about giving you the evidence and the informed decision making to make that practice change, even when it's something as complex yet simple as a policy. It is about having ongoing evaluation of our practice, and it certainly is about facilitating those conversations and having strong leadership to support the work that you're doing. Okay, so this is just a little bit of a plug. The dates on this are wrong, but they will be updated shortly. I think one of the key things in the work that I do, and someone was asking me today, and I said, well, when we started here in our research unit, it is like there was 3 of us, probably making up a total of almost 2 full-time equivalents. We couldn't do a whole range of work on our own. We had to engage people. And in engaging people, we had to build research capacity and capability. And that's important because the people who have the important questions that need to be addressed in practice are the people in practice. So therefore, my job is to be able to support them to understand how they can do that, and to work with them to actually address those clinical questions. And I think that's fundamental. You can't do it on your own. Nothing can you do on your own. I'm just going to run through some of the projects that we've done using that approach, because I know Susie will be telling me I'm out of time shortly. So this is about clinicians driving practice change through action research. It's actually, I don't know if Fanny's online today, but this is Fanny David's work that she's leading with a number of others, and I know Denise has been involved. And this, why is this a person-centered approach to falls? Is because what Vanny and her colleagues did when they did the literature search is they actually looked at what's already been done and where the gaps were. And they actually found a program where they used critical reflection after the incident with staff and with patients to see what do they think happened before the fall, what led to the fall. So stories with patients as well as with staff. But the interesting thing was also asking the patient what the solution was. So why do we think we've got the solution? People have been falling forever. We haven't got the solutions to date. So why not ask the people for whom it's extremely important? And that's the patients. And so that's what Vanny's doing there. We've got Alira. She's been looking at aging simulation, really trying to enhance people's empathy towards older people. And to do that, it's like, how do I know what it's like to be an older person? I make assumptions about what an older person would do or could do or would not do. So Alira's study is actually working with clinical teams to put them through an experience, a simulation experience where they actually wear a suit that demonstrates aging. And so the nurse, fit and healthy, puts certain aspects of the suit on, and then suddenly they can't read a brochure. They can't walk to the toilet quick enough. They can't open the sandwich. So it's really trying to get people to think about what it must be like for patients. And Alira's just finishing her study, writing it up and hoping to submit her PhD in the coming months. So it's really been exciting work. And she has showed that the intervention of using this aging simulation suit has actually made a difference in practice. And then we've got person-centered learning. And I know that Denise is online today. And this is really a really neat piece of work, because what this is doing is it's actually taking something that's been in our practice for quite some time, clinical supervision, and it's using the person-centered practice framework to see, well, actually, if we use a person-centered approach and then we use the framework to help focus, and this was with new grads, focus the outcomes in the conversations, would we actually have an influence on person-centeredness? And so Denise has collected all her data and she's currently analysing that data, and we can't wait to find out what the outcomes are. But certainly I was part of that process and I found it extremely beneficial. I was doing supervisors, so I wasn't doing the graduates, but I know from those supervisors they had really fantastic conversations around person-centered practice with these graduates, which is fabulous. And then Julia Kitch, who I think is maybe online today, she is doing a study, a stoma adjustment study. She's using action research. So all of these approaches are using person-centeredness practice development underpinnings. And she's using action research. And the really interesting thing about Julia's study, it's all interesting, but the really exciting thing is she's actually working with consumers to co-design the study. Now, often we say we're involving consumers, but what we really mean is we're getting data off them, which just has a place, but she's actually working with them, and she's worked with them to do the analysis of the original focus groups. And then together they co-designed the interview study. And now she's training up the consumers that have volunteered to be the interviewers of other participants. So I think that's pretty exciting. It's amazing getting it through ethics without too much of a drama, but I think this is the way of the future, co-design and having our consumers working alongside us. I talked about the fact that it's really important that we are taking care of staff, and this programme here actually came out of an issue that a director of nursing identified at one of our hospitals, where she felt that staff were just, you know, she'd had some survey results from the USA survey and it wasn't that great, and she wanted to know why. And what we ended up doing is we ended up co-designing a wellbeing programme, which was then called the Wellness Wednesday programme, then went on to be called the Imagine programme. And we co-designed it with clinicians, and we tested it out. We only had a small cohort of 23 in the first innings, but we showed that it actually made a huge amount of difference. And then we applied for some more funding and rolled it out across our organisation. So that was an issue that came through another form of data, but the director of nursing wanted to pursue something, and so that's what we went ahead and did. And there's also knowledge translation. So this is something that came from CESLID, and we pinched at ISLID via Kant Kiri, who was down here at the time. And it's always to remind ourselves about that connecting with compassion. Certainly, as I said at the beginning, the 4-year-old girl and the 4-year-old girl's mother, there was a lack of compassion. So compassion is really, really important to me. I think that compassion is fundamental to everyone's care. It's fundamental to each other as well. Oh my gosh, I have run out of time. This is another piece of work. This is a much more broad piece of work here that we're doing. It's around quality and safety, and it has a number of domains. And the reason that we established this program of work is because we wanted teams to have data that was meaningful to them. And so this, there are lots of pieces of data out there that teams never seem to get access to at a unit level. So this was a piece of data that we could use that actually gave information back directly to teams so that they could look at what their results were from a staff perspective and start to think about, well, how might they change some of their practices? And then the impact study, which is really interesting. So the safety attitudes questionnaire data is from the staff perspective, and the impact study is measuring a set of 8 key performance indicators that is taken from the consumer perspective. So the consumer addresses questions like, you know, how safe did you feel in the care of the nurse or midwife? So it's all about the consumer perspective. And the great thing we had here down in ISLID is we had a number of units, 6 of them doing this study, and they were doing the safety attitudes study at the same time. And we were able to bring together those 2 pieces of the puzzle. So they had a perspective from patients and a perspective from staff, and it told them, along with all their usual metrics of data, what was actually happening in the clinical area. And that was really fundamental to them undertaking QI projects and actually improving their practice. Whoops. So how am I going for time? Oh gosh, nearly out.
A few minutes.
I think it is about being person and people-centered, and that does include the compassion and the need to sustain that. It is about effective ways of working, and you can't really, if you look at high-performing teams, there's something special about them, but that's what we want for every team. It is about effectiveness and making sure we're doing the best with the resources that we can. It is broader than just nursing and midwifery practice. It is about integration, the whole health and social care area. It is about the learning and the development that we need to do. And it's actually about supporting people to do the innovation and to take the risks. And that requires leadership and support from a wide range of people at the meso and macro levels. But that's what we need to aim for, to ensure that the cultures that we work in are there to enable people to thrive and to flourish. Now, that's just my little bit of propaganda at the end, if anybody wants to read anything further. But because the IPDJ, for people who want to read further, is a free access journal, been publishing practice development and research for many years. So if people want to go on and they can have access to these slides, they can just click on there and you'll find everything and anything that you would want for. And the International Practice Development in Health and Social Care 2nd edition was launched earlier this year. And that's really exciting. And the exciting thing about it is I think we had 54 or 55 writers, teams across the world, and multidisciplinary. So that was really fantastic. And consumers, we had consumer engagement as well. Oh, that's me. Thank you very much.
Okay. Thanks, Val. That was wonderful. So I think I'm just aware of the time. This is our questions and answers for you, Val, isn't it? An opportunity for anybody to ask you anything. And, you know, after sharing such great bodies of work and inspiring us with all of that. So shall we use the chat box, or you can unmute and ask any questions to Val, if anyone's got any?
Everybody suddenly goes shy when it's like, oh, you can ask a question.
This is Lauren from Transitional Aged Care at Port Kembla Hospital.
Yeah.
I just wanted to ask what your perspective is and where you feel like all of this sits with therapeutic use of self as well.
Well, I must admit, it's not an area of my expertise, but we certainly use, so there's a theoretical element of practice development, which is called critical creativity. And that uses therapeutic use of self to try and create solutions. And so that is quite out there. And I've done quite extensive work in that area where I've had to take the huge risks to do it and let the body shape and tell me how to actually how to get the solution that is inside my body out, if you like, if that makes sense, because we have those solutions within us, but sometimes they're trapped and it takes a lot of time to get out. So using therapeutic sense of self to help that, but I haven't done it with patients. And maybe that's an area we could discuss further, and happy for you to take that up with me.
Thank you.
Cool.
Thank you. I'm just going to share my screen, Val, at the same time. Is that all right with you? I don't.
Absolutely, it's not a problem.
Have you got my whole screen with just the survey on now?
Yes,
we do.
Not yet. Any other questions popping up?
There was a question in the chat box, Susie, and unfortunately, apologies, there's only the employee number. But somebody out there is asking what wards at Wollongong, Val, are you using for the study? And I imagine they're talking about the impact study, perhaps?
Quite.
Sorry, I couldn't.
You're a bit
quite
muffled
hear that.
there.
Apologies.
Oh, can you hear me now?
It's a little bit distant.
Do you want me to repeat it, Barb? One of the questions was, what ward at TWH are you using for this study for the PhD?
Which one? Because there was several PhD studies. So
I think that I asked that question and it came back to the impact on patient safety, their experience. So I think there's actually 2 studies.
Yes.
One is the impact study on patient experience of person-centeredness, and the other one is the safety attitudes questionnaire. If that helps. Sorry, I don't know the person's name, and it goes back to being person-centered and not wanting to call someone that. No, person, so I really apologize.
We've just got a number.
Yes, thanks for bringing that up, Denise. So just to clarify, the safety attitudes questionnaire is done across every single clinical unit and ward across the whole organisation. The impact study, which was measuring the key performance indicators, that was just done on 6 clinical wards across 3 hospitals because we were trialling it out in a new app version. that app is currently being updated, and it will be launched, I think sometime early next year across the whole of New South Wales. Well, they'll be piloting it in certain hospitals, but the updated app will be available for people to collect consumer data that is in a very timely fashion. And the app is kind of special because it analyzes the data for you and helps you spit out a report at the end of it.
Thanks for that. Nice comment there from Joanna Harris Val. She completed a PhD using feedback of patients and health professionals to understand ethical standings of contact precautions. And she's got a dream that one day infection prevention and control will be person-centered rather than pathogen-centered.
Absolutely, Jo, absolutely. Yeah. Well, look, you've been making great inroads in the work that you guys have been doing around COVID, and as much as we can to be person-centered in that space, because it is quite confronting for consumers as well as for staff. So I think the team that Jo's been working with has done a really good job there.
Great. Lovely. Well, guess what, Val? You're absolutely spot on time. You've done a fabulous job at your timekeeping. We've got the evaluate. Any more questions, feel free to put them in the chat, but we've got an evaluation on there. And as we said, if you use your phone for that, it will come up into on Microsoft Forms and complete that for us. Just so we can co-design the next, across 2022, the series and consider those focus groups and areas that we might want. So has everybody got that? If I take that slide off, because we've got another nice slide for you.
An even better one, Susie.
Yeah, so this one is the next slide. So we're very excited to share that we've actually already populated the next session, which will be in April the 5th, because we just so happen to have an opportunity to ask Professor Kim Manley to do, she's over here for the Enhancing Practice Conference in Wollongong. So we've snatched some time, haven't we? Val was able to get 45 minutes with her. So she'll do it the same time, 2:30 on Tuesday, the 5th of April. And she's going to be doing a session on guiding lights for effective workplace culture. So very fortunate to have her here and get her time as a practice developer. She's from, as you can see there, Professor of Practice Development in the UK, and done lots of work around workplace culture.
And I probably could say that when I went to PD school back in 2001, it was Kim that asked me the question that completely changed my way of working and completely changed my life, really. So very inspirational.
Yeah.
So I encourage anyone those who have heard her to come along, and those who haven't heard her to come and listen into the wisdom. Yeah,
it'll be so wonderful. Yeah.
Susie, it's Beatrice.
Hello, Beatrice.
Hello. I'm just wondering, I noticed that the sessions are being recorded. For those of us who can't make any subsequent sessions, where might we be able to?
I'm glad you asked that question, Beatrice, because I've got a little note for myself here to just remind everyone that we have recorded them. So you can absolutely, we'll be sending those on somehow. The working group for this series will get together and consider how we get that out, Beatrice. But you can feel free then to share it amongst colleagues. We might be able to get it on the intranet quite quickly at Illawarra and Southeastern, but we will definitely, that was the whole reason for doing it. Yeah.
Okay, beautiful, thank you.
So we can have a lovely series there for people to watch again too. Yeah. Great, nice comments, thank you.
So that concludes, Susie?
Pardon?
That concludes our session today.
That concludes the session. We will thank you so much, Val.
Thank you, everybody. I hope the rest of your day goes well, and I'm off on holiday at the end of today, so I'm really excited.
Oh, good to hear you.
Okay, I'll talk to you later.
Thank you all.
Thank you so much, everybody.
Thank you.
Thank you.
Enjoy
Bye.
your evening. Bye.